and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
And I am Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
Well, in our opinion, Bob.
Okay, Brad, today I was going to show you how to take a manual blood pressure. And a lot of times people don't have to do this anymore because there's those electronic units.
Right.
And there's actually those ones, those little wrist units.
Right.
But a lot of those are very inaccurate, I have found.
Or inconsistent.
Inconsistent, right. So you really should know how to take a manual one if you're in the medical field. And I don't know if you could do it if you're a layperson. Maybe you could.
Well, my dad used to before all that other stuff about 30 years ago because his blood pressure.
Okay, so you're going to need a stethoscope. And by the way, I didn't know this, but on some of the stethoscopes you can listen to on this side, which is the diaphragm, and the other side, which is the bell. Now on this one you can't. This one has no bell on it. And I think you're always going to make sure that's tightened up too, and you want to make sure you can actually hear with it. Yep.
That worked, yep, huh?
Yep, all right. And then you got the blood pressure cuff itself. And this has got the inflator, the pump to inflate it.
Yep.
And then it's also got the sphygmomanometer.
Tells you the pressure.
Right. And we're going to show this closer up later on so you can see exactly what we're looking for when we put it on. So you're going to start off, you're going to have the patient come in, and they're going to uncross their legs, okay? And they're supposed to be relaxing for 3 to 5 minutes. That doesn't always happen, does it, Brad?
Right.
I mean, a lot of times people get their blood pressure. You want the arm at around heart level, which we're pretty close here. You want to ask the patient usually which arm they prefer. Some of them might have a shunt or a PICC line, or if they've had a mastectomy
Or a pacemaker.
Yeah, you want to avoid that arm, obviously. So you're going to start off by you're going to palpate the brachial artery. That's the artery where you're taking the blood pressure on. And the brachial artery, if you look at the bicep and where it attaches, right here, the brachial artery is usually right here, just medial to it. And you can, and the whole idea is you're just trying to find it because that's where you're going to put your stethoscope. All right, so yours is right there.
Yep.
All right, so you're going to take the blood pressure cuff, and before I even put it on, I'm going to go ahead and tighten the or rotate the inflator. What would you call that little knob?
Clockwise the valve.
Yeah, and
Close
you're
the valve.
Go righty tighty, lefty
Right.
loosey, but righty you're going to tighten it so that tighten it up. Now on most of these, there's an arrow that shows. If it's the right arm, it has an arrow for the right arm. If it's the left arm, there's an arrow for the left arm. This one doesn't have that.
Yeah.
So it just kind of has a little gauge there where you're supposed to put it. But so.
Right there, can you see that?
And you're going to put it up fairly high. There were interesting comments that were online about this, Brad, because it was said that you were not supposed to take the stethoscope and put it underneath the cuff.
Right.
It's supposed to be below it.
Right.
Although in some cuffs, it's actually attached to the cuff.
Yeah.
So and I always got accurate readings, despite that fact.
Right.
So I'm gonna make sure it's up high enough here.
So we're going through this step by step by the book. After you do 100 of these,
Right.
it just goes like that.
Now the cuff itself should be, you should be able to slip a couple fingers underneath it. If it isn't, maybe the cuff is too small for the person, or if you get a really small person, you might need a small cuff, a pediatric cuff. So you got the inflator, you got the gauge here, and what we're going to do is I'm going to go through it without showing the gauge first, and then we're going to go through it showing the gauge.
Right.
So with a close-up. With these, the stethoscope, a lot of times the earbuds actually point one way, and they point forward. They should be pointing forward when you put them in your ears.
It fit more comfortable, you get a better seal from the noise.
So I'm going to go ahead and put this, if I'm talking really loud, let me know. So I'm going to put this right on the brachial artery.
Yep.
Put it a little bit above.
Now, I'm going to step in here with this. There's usually a clip on the back. You can clip it here. You can clip it on their clothing. Sometimes I have the patient hold it so I can see it, depending on how alert the patient is.
So it's righty-tighty. I'm going to inflate to about 200 millimeters, 180 to 200 millimeters of mercury.
Yep.
And I feel like I'm talking really loud.
No, you're fine, Bob.
Okay, and then, or you can go maybe 30, 40 millimeters above what their highest reading has been if they know what it is.
Sure.
So I go up to the 200. Can I see it, Brad?
Sure.
And then then I'm going to take the knob, I'm going to twist it left, and slowly let it out a couple millimeters a second at a time. And at first I'm hearing nothing, and then all of a sudden I'm going to hear a bump, 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 and at that first spot where you hear that bump, 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 that's the systolic pressure, the higher pressure. And then it starts to fade, and that's the diastolic pressure.
Right. Now I just want to say one thing. A lot of times you'll see the needle bump, bump, bump too, but this is not a visual. You don't get the numbers from where the needle starts moving, the bump, bump. It's the audible.
It's the audible part of it, exactly. So why don't we cut away, and then we're going to show the close-up of it.
Okay.
Go ahead. All right, this is the dial, and you can see Brad's pumping it up, going up to about 220, and now he's going to let it go, and let it, again, 2 to 3 millimeters of mercury a second, I'm sorry, and he's letting it go, keep going, and at one point here, you're going to start to see it bump a little bit. It's bumping right about there, about 130, well, even worse there,
Yeah.
a little less than 120.
Look at that pulse, Bob.
Yep.
You're alive.
Yep, and then
This is proof.
and then right around 85, which is usually my low number, that's where it stopped bumping. So,
But again, I could still see a tiny little
Yeah.
pump around 70 or so, but
right. So that's why you're going by the sound. You're going to first when you
that's
first,
called audible, Bob.
right oscillation.
Oh,
it's actually called.
wow.
So when you first start to hear the sound, that's the systolic, and then when it goes away, that's the diastolic.
Sure.
So that's the two numbers. Well, it's good to measure on the same arm each time, and normally what normal is considered is 120 over 80. Although we had a whole video on that too, didn't we, Brad?
Right. Yeah. So, some details on.
All right. Thanks for watching.
Yeah.
See you later. I am Blob.
Blob.
Start again. Sorry.